Hi, listeners. This is a quick thank you for listening and for your ongoing support. If you're enjoying the program, please consider clicking the follow or subscribe button if you haven't done so already. It really helps us out. There's no better way to support us than doing that or sharing the show with a friend, colleague, family member, or any new or expecting parent in your life. It's totally appreciated. On with the show. Hi, I'm Sarah Trott, and welcome to the Fourth Trimester Podcast. I'm a new mama, and this podcast is all about postpartum care for the first few months following birth, the time period also known as the fourth trimester. My postpartum doula, Esther Gallagher, is my co-host. She's a mother, grandmother, perinatal educator, birth and postpartum care provider. Fourth trimester care, our topic, is about the practical, emotional, and social support parents and baby require. And importantly, it helps set the tone for the continuing journey of parenting. Hi, this is Sarah Trott, and welcome back to the Fourth Trimester Podcast. I'm here with my co-host, Esther Gallagher, today. Hi, Esther.
Hi, everybody.
And we are also joined by Celeste Brinkerhoff, who is a certified peer support specialist and holistic health coach. Today, we're going to talk about micronutrients and how they support the mind and the body in the fourth trimester. And we're going to share a lot of useful tips as well as actual resources that you can go and use right away in your journey. And this is going to be helpful information for new and expecting parents, but also their entire supporting community. We're really thrilled to have you on the show, Celeste. Welcome.
Thank you so much, Sarah. Esther, great to be here with you both. I really appreciate your platform.
Yeah, thank you.
It's wonderful to meet you and have this subject. I'm a fan.
Awesome. I look forward to sharing and unpacking what has helped me survive my fourth trimester.
Yeah. So let's just launch off from there. Tell us more about your story.
Sure. So I have grown up in rural Utah, and from a young age, I probably presented with symptoms that were diagnosable, but they were never really treated until I had a first break that coincided with my high school graduation. And so at the ripe age of 17 into 18, I was labeled with some heavy hitting labels, things that are considered SMI or serious mental illness. And trying to keep hope alive while you have this limiting medical prognosis has sort of been the journey that I have been on. And starting then, I really knew I'd have to question, I'd have to self-advocate. I had a family who instilled a lot of great things in me, like a good work ethic, reading, asking for more information, and never giving up, right? So we also ate well. My mom grew a garden. We hunted wild game. And those were sort of pillars that I think kept me alive. And I've been able to defy incredible odds, surviving some of like the worst parts of humanity and unfortunate experiences that I wouldn't wish on anybody. But because of this sort of background in taking care of myself holistically that my mom and dad sort of framed up for me, I've learned so much about mental illness. And actually, I think we're at this really wonderful threshold where it's changing. Psychiatric care is changing. It's turning into more of this metabolic conversation where integrative tools are coming to bear. There's evidence behind them, and we can start to actually take control of our mental well-being, understanding that the brain does live in the body and is going to respond to the environment around it. So through this adventure, I'm now 40, I've developed quite a robust tool belt. In 2012, I knew that things would probably be interesting and I should learn more about nutrition. So I went to the Institute for Integrative Nutrition and studied thousands of different perspectives about well-being creation. And that gave me more strength and information to survive my conditions. So getting that certification, I did some corporate wellness coaching and some private coaching, and then became a mother sort of in a kicking and screaming kind of way. And outside from the first break at 18, I had not engaged in the psychiatric inpatient care units, but postpartum misadventures, some traumas and things landed me in inpatient units about 7 or 8 times. So it was really getting rugged, and my family rallied, and we returned to holistic care that I had found in Colorado in the early 2000s, and they were leading the way with functional diagnostics. And this really helped open the door, because in the standard model, my PPP was sort of termed treatment resistant, and my daughter was going to lose her mom. But because of this clinic called the Wholeness Center, doing functional testing, we found out that half of my problem really came down to something quite simple: benign metabolism of folate. I had some complications with an enzyme, a genetic mutation, right? And then I also had a folate receptor autoantibody. So it was like a pinball machine where folate should go. My brain was kicking it out. It couldn't penetrate the blood-brain barrier. And folate is so imperative for not only fetal development, but our overall biochemical map. If we don't have folate in a bioavailable form, we can't detox. We can't take in good nutrition. So this was like groundbreaking. I'm like, what? 20 years of really rough-handed, heavy artillery psychiatry, and I needed something like active folate to stabilize? What else, right? Like, so this kind of made me think, what's more to the story with people and, mental illness? If it's severe in nature, maybe we're not asking enough questions. Maybe there's more we can actually find underneath a microscope if we do testing that's not based on observing a symptom set of a distressed individual.
So there is a way to test for folate.
Yes.
Okay.
Yep.
And specifically to test for whether or not you have active receptors, active uptake.
Yes.
Evidently,
right? And I was just so lucky that despite my label, like putting bipolar with schizoaffective on my intake forms at this clinic, wouldn't necessarily map over to that test, right? They do find these folate receptor anomalies in seizure disorder and autism patients, but they don't typically look at it for neuropsychiatric things. However, there is one company doing this test, and it's just like another autoimmune assay. And because this clinician's like, well, Celeste has tried everything. She's not doing well. What can it hurt to turn this stone up and look underneath it? And thank God they did, because taking an active form of folate to compensate for not only the genetic enzyme not functioning well, but this folate receptor problem meant that I could finally flood my nervous system with folate. And then this unrelenting psychosis, or this treatment-resistant mania, was settling down. And on this journey of integrative recovery in 2019, there was a traumatic event. I wound up back inpatient. They actually withheld my folate and gave me psychotropics and watched what happened. And I had to self-advocate and say, can you please give me the folate? It's just for a medical condition. And when they brought that folate, it was called leucovorin calcium, it's prescription strength. They brought that back on, and all these symptoms of agitation and inner restlessness went away. I'm like, see, it's actually quite simple for me. And everybody's going to be different, right? So that's the thing with mental illness. I don't think we can get away with blanket diagnosing people anymore, but I think we can stay curious, and I think we can try to self-advocate, because the peer-led conversation is very important. And I think, practitioners maybe haven't been able to learn enough about nutrition as it relates to brain health and psychiatric well-being. But hopefully through conversations like this, we can empower them to learn a little bit more about these biochemical and enzymatic situations that underlie how we make neurotransmitters and how we function.
what a story. Celeste, do you want to tell us, maybe give us a little more nuance in terms of both your teen episode, but maybe if it's easier or more straightforward, sort of the inklings, as you may or may not have gotten them at the time, but of like, oh, I'm going down, I'm going there.
Yeah.
And just maybe you have some inklings of how it unfolded. You named trauma, you named, a rugged birth story, but once all of that had happened, like, how did you start to understand, I'm not well, I'm not doing okay, I'm having a hard time?
Great question, Esther, and I appreciate that. So I'll do a quick timeline. My mom didn't know she was celiac when she had me, so she was ingesting something that kicked her immune system up. I had the cord around my neck when I was born. And then I do recall, and I talked to Jane Honigman about this, but at age 8 in the Mormon faith, they do this ritual of baptism and confirmation. That is when I recall rage setting in for me. It didn't feel resonant with my being. I didn't align with it. And I would start journaling about how angry I was. And my parents read these journals, but they didn't get me help. Half of the fiction stories I wrote in my elementary school were alarming, and they should have been seen as cries for help. Because if I could have been supported earlier, I think a lot of adversity would have been avoided. But because I was not, and because of the nature of the culture, there were certain vulnerabilities for a woman like me. And that meant some predation and some grooming and some sexual abuse that happened that was never really acknowledged at the time of my diagnosis at 18. I think, again, if that trauma history had been factored in, the treatment trajectory could have looked a lot different. But sometimes it's not part of the diagnostic conversation, and a distressed individual who's disassociated from their body may not have reference to the memories about what brought them into the unit in the first place. So that
or
was
may
kind
be
of,
afraid to express them.
yeah.
Right. I mean, that may be why you don't have access, right? I'm pushing it down because it's so fearful.
Right. Or if people
On
want to disagree with you, right? If it's something where you're like, no, that didn't happen, and it's sort of a gaslighting situation that can happen, it becomes a little bit hard for that to be the thing you advocate for, I guess. But I've been lucky, and I've always had, like, a saga of therapists and specialists working with me. And I think healing is a non-linear journey. So as I would get stronger physically and mentally, I find new treatment providers, and some were specialists in toxic relationship patterns, right? And that became a very important piece to unpack. And others were experts in this sort of biochemical holistic well-being thing. Thank goodness now, I would say the last 4 years, I left my daughter's father she was in kindergarten. The last 4 years, I've been able to really go deep to some of these early ACEs, adverse childhood experiences, and better see myself in context. Now a 40-year-old woman had this interesting history. Why was that, right? And what can I do about that so that my next decades with her are ones where we're safely embodied and we're thriving and we own our history and we learn from it, and we can do early intervention for her, and we can do prevention for me and others, because we can use this adversity to hopefully keep a light of hope on for my peers who might let shame keep them from seeking help. I think that's one of the biggest killers out there, is actually stigma and shame, and people might not feel like they can open up.
Yeah. Well, thank you for sharing your story.
You're
Yes,
welcome.
I appreciate it. Yeah. I want to name 8 years old. For me, as well as you. And I think probably people listening will be like raising their hands at 8 years old. I think there's an important consciousness shift that starts to happen around that age. It's biological. It's spiritual, but I think it's very an embodied thing. And I think in this culture to this day, we're fortunate if we don't begin to experience our environment as quite toxic, and I think rage is exactly the right response. It's just, where do you go with it, right? Like, unfortunately, it's not going to get met in any kind of appropriate way that moves the energy and the consciousness to a better place outside of us, let alone inside of us. So thank you for that story. I really resonate with it. I really appreciate it. And I think many, many people are going to.
Thank you for letting me land it here, because it's been really a beautiful look in the mirror with my child coming into these prepubescent changes. And that's when ADHD symptoms can show up for girls, right? And become extra noisy. And through living my life out and watching her reading, researching and stuff, I'm like, oh, this is great. She's self-advocating now. She has words I didn't have at 8. And this is how we can equip young women to move through very difficult and maybe overwhelming pressures coming from culture, right? We can help them have tools and language for their emotions and a resource roadmap, really, because now I feel that she has a container that I didn't have, and that is progress.
And I dare say it's not just female-bodied people.
Correct.
I mean, I think it's overwhelmingly going to tip in that direction because of patriarchy, but I don't think that means that young male-bodied people aren't also swept up in the trauma of it. So, yeah, thank you.
Yeah, I appreciate that you said that, Esther. And if this isn't divulging too much, but learning about my relationship patterns while also having been eclipsed from fully owning all the sexual abuse history meant that I was attracting people who'd also been victimized in different ways. And maybe they were partially conscious of it, or maybe they were trying to suppress it because the wound was too much. But because it's not normalized to try to deal with these things in our Western society, I think that that's where a lot of toxicity and mental health issues metastasize, is in the silence. And if only one person is help seeking, how far can it go, right? And I don't fault these other people for what they endured, just like I would hope they don't fault me for what I've endured. But I would hope that together, we can figure out how to become stronger and more emotionally intelligent and compassionate with one another.
What a beautiful message. And of course, all of this directly relates to the fourth trimester. It all directly relates to preparing oneself for the transition into parenthood. Right?
Absolutely. Yeah. And because again, going into motherhood, I wasn't fully owning this sexual abuse. When I gave birth through the organs that had survived abuse, I was like, what? Suddenly I'm back at 17. And you can kind of see it in the pictures of me in the delivery room with my baby. I am wild-eyed, and nobody knew how to really speak to that. It was maybe like the elephant in the room. But I was in a 31-year-old body, but I was emotionally transported back to a very difficult time, right? And so to begin disassociating right after labor and not even know myself that was what was going on, that definitely compromised how we could securely attach and learn how to get her latching and the sense of felt safety that is so important for nursing and that bonding period coming home with an infant.
Mm-hmm. Or even just being home, because again, I was your age. I was 17 and 18 when I was pregnant and giving birth.
Oh, wow.
So the closeness to the childhood traumas was more there. And I had wonderful home births and really long, sometimes very dark postpartum periods that nobody was around. I mean, in some ways I say, thank God, thank the goddess nobody was trying to diagnose me at that time. And I was just struggling through and had just enough freedom and support to not go down further, or into a system that would have chewed me up and spit me out badly. But yeah, I think, yeah.
Sounds like you felt that sort of initiation again to like re-examine your life. And motherhood is such an initiation. It's a beautiful one, but thank goodness for the work you all do to raise awareness. Some of our peers don't make it through because of health challenges, postpartum, shame, whatever it is.
And poverty. Let's not
Poverty.
forget.
Yeah.
Yeah. Poverty is definitely going to be a factor in all of these things for many people, what kind of access they have,
Absolutely.
where they can even look, if they can even look. Yeah. So
I like that you said that. And I think that, Esther, food can be a really wonderful, great equalizer. Same thing for this mindfulness and the polyvagal nerve, right? What I've learned about, oh my goodness, even if I'm in housing insecurity, which I was, even having middle-aged white privilege, I dealt with a lot of poverty. When you get an SMI diagnosis, you're kind of like set up to be at the bottom of the socioeconomic barrel, sadly. But I knew that if I could employ some of these snippets of knowledge from IIN, right? Like I knew I should eat colorful foods. I knew I should eat fermented foods whenever I could. I would be rummaging at the grocery store clearance aisle, finding the lox that was, a few days past its expiration date. I would be eating the asparagus or some artichoke to support my liver postpartum. So my body had enough inner wisdom to try to navigate and make the best choices despite really what I will call difficult constraints. And this hearty micronutrient formula might help sort of bridge the gap when there are food deserts and things like that, right? I grew up in rural Utah. It's oil country there. Sometimes people think food is what you can purchase at the gas station, right? And the notion of what we put in to our body and mind affecting what comes out of our body and mind it's a huge disconnect, because they're working, they're surviving, they're grinding all day and every day, and it's not been as imperative for them to learn about those mind-body connections maybe as it was for me. So I just think we have this massive educational opportunity in our country to help people. All right, these are your constraints. You're on food stamps or you're in a food desert. What can you do to make a choice that's going to take you that much closer to optimal well-being? Over here, we're choosing chronic disease. And we navigate a continuum, right? And I'm really a big proponent of meeting people where they're at, reducing harm along the way, understanding it's about progress and self-compassion first, because it's a marathon this fourth trimester. It's not going to, yeah, it's just, I'm going to need to keep my stamina up. And being an exacting master is not going to help. It's just got to be a little bit more fluid, a little more forgiving, and rolling with the punches, so to speak.
Mm-hmm.
Yeah.
And so what are some of the practical things you'd want to share with new parents or people supporting new parents?
I think modeling the behaviors like, okay, let's mind our inputs. Let's have clean, healthy water. Let's try to get movement going prior to the baby coming in. So building in some cellular habits, some cellular memory. Like, okay, every day at 10 o'clock, I take a walk. I get fresh air for 30 minutes. And having folks come and cook alongside you. So you're getting some social engagement and you're also building that habit. I was so surprised at my capacity to get told, all right, you need to do a paleo diet to heal. And I was deeply disassociated. I had my daughter and her two big sisters and an ex to feed. I would open the fridge, I'd look at the ingredients, and I would disassociate. Like, well, how do I make dinner, right? What do I draw from? How do I go on autopilot and chef up something? Well, somehow it would happen, but I had to deal with this sort of overwhelm and then come back to the body and engage mindfulness and listen to the sound of the celery getting chopped on my cutting board. Feel the onions, that pungent aroma. It would rivet me to the now. And then I would remember, oh yeah, I know how to cook these dishes. I made them so many more times. So maybe it's like physical therapy for these new moms and dads, where you build these activities of daily living in, because I think it can be very easy to go into freeze mode, which is this nervous system state of shutdown. Come home with a baby, and it's a whole new thing. It can overwhelm people who are even on their third or fourth kid because life events are different with every child. And so for me, it would be like, yeah, let's see what activities of daily living we do pre and postpartum so that we can just move through this holistic wellness wheel more consciously. And of course, beefing up on your nutrition. That hearty nutrient formula, the prenatal daily essential nutrients, has been shown to be protective against postpartum depression. Now, I think they have a study that showed at 6 months, the women who did the prenatal formula were not falling into postpartum depression. So provide protective factors. Things are stressful.
Mm-hmm. Mm-hmm. And you hit on preparing for life with a newborn and building some of those habits and patterns in before baby arrives. And I know we talked a little bit beforehand when we were preparing for the show about some of the specifics. And you've also shared some notes with me as well around specific vitamins and minerals, which is what micronutrients are, right? That you think could be really beneficial.
Yeah, thank you for asking me to go a little deeper on that. So amino acids, and those are the building blocks for our tissues. They are precursors for protein and also precursors for neurotransmitters. So I put a lot of amino acids in. Now, I wasn't on my hearty nutritionals daily essential nutrient when I had my child. I was managing psychotropic abrupt withdrawal, but I did know enough about, okay, I need omega-3 fatty acids because her brain needs these building blocks, and probiotics are going to be important. Also, there's a lot of research out there on choline and how a lot of our birthing age women are choline deficient, and choline is an important component of the cellular membrane. And if we want to provide protective factors against ADHD or ASD or other neurodevelopmental anomalies, choline, no side effect, can help be a buffer against having a kid that's neurodiverse. And if you can try to create the best conditions going into starting your family, by all means, I would highly endorse it, because trying to mitigate after the fact to things that were less than ideal in your environment is way more tiresome and costly.
Well, and you named folate right out of the gate. And, we found out that folate is critical because we finally learned that it was associated with some pretty devastating neural tube defects specifically in babies. That's not just being neurodiverse. That is catastrophic to your existence. And so, the idea that, okay, well, we'll just supplement folate has been with us to some extent, but I think it's been with us long enough that people forget why it's so critical. Well, like we had when I was a kid, there were big billboards, even in my podunk town, by the American Cancer Society, don't smoke. There were public service kinds of announcements for preventive care, as it were. It was very specific at that time, and it was all about smoking at that time and all the things. But I always think about how powerful it would be in this country, because we still all get in cars and drive all over the place, despite the foibles of that if we had public service billboards, right? Here's the nutrients you need to get through life, and especially pregnancy and postpartum. Hello, people. You need this, right? Everybody needs it from the beginning, from before the beginning.
Exactly.
What a shift that could be in our whole approach, right? That public health should be public education all the time.
Public education and common sense foundations, because you're not wrong. We all have a unique biochemical map, but there are some commonalities. We all are going to need inputs like copper, iron, zinc, B vitamins, magnesium. iron, protein.
Yeah.
We all have this in common. So no matter what's going on politically,
Yes.
we're the same underneath. Like we need
Mhm.
water, we need macronutrients, our protein, fat, fiber, like carbs. But this micronutrient exploration and education about the right forms of folate, because Esther, if I were to take just folic acid with my mutations in this folate receptor problem, it actually hits more
Would help.
harmful. So there's a little bit more of a nuance that needs to happen with obstetricians or in the, the midwife's office about just how critical it is to neural tube formation. Neurogenesis is the most metabolically demanding time for mom and fetus. So it would make sense that we really bring nutrition up and have high quality, very bioavailable nutrition to do disease prevention. And for our poverty-stricken friends, what can that change if we set the infant up for better physical health, better mental health? Maybe they won't incarnate and inherit that cycle of poverty and adversity. Maybe they'll be able to go and, build a life of meaning and purpose more easily.
Well, and if you're born in the hospital, everybody supposedly gets a metabolic screen, right? That little heel stick that your baby's going through with all those little patches of blood tests for a lot of things, like 3,000 things, metabolic disorders. But when you speak about functional testing, I'm sure they're not going far enough.
No.
And I don't know that should anything pop up, if it necessarily gets flagged. I hear people all the time who are getting their blood tests, but then their MD doesn't come back and do a deep dive into, oh yeah, you're on the low end of normal for this thing, or you've got this showing up and maybe we should do more. And it just seems like we could be doing this from childhood, right? And really address so much that is individual, right? That is going to be more individual.
Yes, and not to nerd out on you all too much, but because I had this sneaking suspicion. I had this sneaking suspicion that there were two enzymes that were playing a role in the more serious presentations of mental illness. Because it metastasizes in families, I have a family where there's this legacy of madness, right? And also chronic health challenges like arthritis, autoimmunity. Well, those all relate to one particular enzyme, MTHFR. And then there's this other one that I was like, I want to figure out COMT, and that's called catechol-O-methyltransferase. And in my private coaching practice, if folks want to get a sort of rudimentary cheek swab, we can look at those two genetic polymorphisms. And what's fascinating is once you have that concrete data, you can work more effectively with your doctors to self-advocate, because we don't have perfect medicines for that yet, but we do know that the provision of cofactors like magnesium and the right forms of the B vitamins will help improve the function of these enzymes, thereby reducing psychiatric symptomology. And it's actually a quite gentle, side effect free approach. But there's so many people who've been in the system a long time and nobody ever tested that for them. Again, I'm just really glad we're kind of at this renaissance within psychiatric care where there's entire departments at certain colleges for nutritional psychiatry. And we're starting to marry the brain with the body again, which is a beautiful thing. And it gives me a lot of hope for future generations that they're going to get the right information at the outset. Like we tested my daughter, and heritability factors are a thing. So now we know she's, a lot like mommy. I don't want her to go through the things I did. So now I'm going to have to advocate my whole life, help raise awareness, reduce stigma, and help people better understand, like, here's what's up. These are things we might do to reduce risk. And of course, the burden of disease is not only an emotional one, but it's an economic one for our communities. So I think it behooves us as a nation to try to understand these from every angle.
Yeah,
absolutely. And I like that you're talking about working with someone such as yourself, in addition to a team of medical providers. We're not saying that you can self-diagnose And this show is not a diagnosis in any way. You do need to work with professional people who have the right credentials to support you in finding the right answer.
100%.
Celeste, I don't know how possible this is, but it would be very interesting to find out about schools that have departments of nutritional psychiatry, because it occurs to me that there may be a pathway for people who are less financially fluid to maybe be able to access some education and care through the university system, because, studies are happening and all that kind of thing. I mean, we live in a university medical town, so Sarah and I, I'm aware that UCSF is doing studies all the time on something, right? Not necessarily nutrition at all. I don't know, but there are studies in our city. There's the overlap between the more public health system and the more private health system. So if you're somebody like me who's low income, you can be getting Medi-Cal and still be getting care through both your public clinic and ties to the university system. And so I think that's sometimes a huge benefit.
I have been blessed to travel with Hardy Nutritionals and meet clinicians doing cutting edge work. And you're right. So certainly they are often recruiting for study participants, or at least you could access complimentary education and workshops to better inform yourself and self-advocate with your clinicians that have the appropriate credentials to support you, or also go to the Google search.
Well, if you have any resources that you want to list, we'll put them all in the show notes so that it'll be very turnkey for anyone who wants to research and find more in our show notes.
Absolutely appreciate that. And I like to offer that free discovery call because from this lived experience angle, I just do a health history with folks. And then based on how they answer that, can say, you might try this. And I like to do a sort of personalized, and it's not a treatment plan, but it's a personalized recommendation that you might ask for this test at your doctor's office, or you might want to start here. Because for me, I threw spaghetti at the wall. I mean, it was traversing all over town from the WIC office to the nurse family partnership to drop-in daycares. I exhausted all of the resources. So I'd like to say I've learned through this empirical gathering of data what works. And if I can soften the blows and make this less of a challenge, let me share information with you.
Yeah, that's so generous of you, Celeste. Really, I think it's very generous, and I appreciate it.
Yeah, absolutely. Happy to do what I can. Family health is really important.
Yeah. And I want to give you the opportunity to share other resources for new parents.
Thank you for that. So I think with regard to things that helped me, it was great to have community-based acupuncture. And that was a critical tool. Not only did I get an hour of time to myself, but it was balancing, helping restore sleep, helping restore endocrine function or thyroid, all that. So community acupuncture, Google, you can probably find a community acupuncture in your city. The nurse family partnerships, those are usually something that your county will run. Diaper dens, because if you're on food stamps or WIC, they don't pay for these necessary things like diapers or blankets or clothing. So I found through church organizations ways to augment the welfare that I was receiving. And nobody really wants to be on welfare. I really believe that. I believe that it's actually a lot of work to be a welfare recipient. So if you can do anything and take any pearl of wisdom away from this, do preventative measures. If you know you want to start a family with your girlfriend or a fiance or wife, both of you change your epigenetic expression by taking high quality nutrients, start building healthy habits together. Address your substance abuse, address your mental health, get into therapy early. Why? Because it's worth it. If you can have this sort of container, got yourself firing on all cylinders, it's way, way more enjoyable. coming into parenthood from the survival lens is not what I would recommend, right? So an ounce of prevention is worth loads of cure, and optimizing well-being, even if you've had a lot of adversity, is still possible. They told me I would never amount to much, and I'm somebody who likes to defy odds, I guess. And it's been nice to be able to emancipate myself from the inpatient system of revolving psychiatric care, and to now be working to change my socioeconomic status and to have this secure place where my daughter can address her traumas. That's, to me, cycle breaking, and I hope every parent out there feels inspired to do that same work.
Beautifully said. Thank you.
I want every 8-year-old to listen to the podcast. Sarah's heard me say it before. I'm like, though, the fourth trimester is, everyone needs to know about the fourth trimester because we all go through it one way or the other, whether it's just because we got born. If we never have kids, we will have been through a fourth trimester. And if we are going to be parents, then there will be a fourth trimester in our lives. And so preparation before, during, and after is really great. And I've said this story before, but my gay Tai Chi teacher, when we were talking about what I do for a living, goes, "Oh yeah, I knew about all that stuff when I was a little kid, growing up in Southeast Asia, right?" So, he was never, in his case, never going to be a dad, but he still had this awareness that people go through this very special and critical time, and that we all exist to support it, whether we do or we do not. So
I love that you said that, Esther. And if I may just talk about, sometimes people are willfully ignorant, and maybe that's because of the dynamics that might be not the healthiest in nature. But when my ex shared with my dad, like, "Hey, you're going to be a grandpa," my dad was not excited. He's like, "Do you realize that this bipolar condition is kind of like tricky? It's been hard to keep Celeste alive." And then he gave him a book, Bipolar for Dummies, and other books about bipolar disorder, and he chose not to inform himself. And that meant vicarious trauma for everybody who witnessed this. So don't be willfully ignorant. If there are known vulnerabilities for your village, for your loved ones, shore each other up, because I can't take back what those kids saw. The system did spit me up and, chew me up and spit me out. There were terrible accidents that happened inpatient. That's not everybody's experience. And I don't want people to be frightened of seeking help, because it was likely safer for me to be in trauma-informed facilities at certain times. But learn about what you're working with. And that is how you mitigate risk and reduce harm and prevent tragedy, because the touch and go nature of dealing with somebody bipolar who has to do an abrupt chemical withdrawal, even the psych MP, he was willfully ignorant. He should not have informed me to cold turkey stop my meds in the first trimester, but he did. And that meant certain fallout. That meant, like quitting a job irrationally when I should have kept it. But just like, hindsight's always 20/20. So look ahead, play the long game, and understand that it's okay to not know what to do, but try to ask questions early and often.
And know that it's a journey. Like every day is an opportunity. Even if yesterday you were overwhelmed and didn't take a step that you maybe are more ready for today, every day's an opportunity. And I don't know how we collectively and individually cut through that. What I agree in a way is you're naming as willful ignorance. I think for some people, recognizing that in a capitalist system where everything, including our minds, are co-opted, right? That there's a lot of pressure to dissociate. There's a lot of pressure to not participate in a holistic way, to not engage and connect and bond and share and support. So this sort of underlying mantra that we kind of have, which is, I've got this and everyone gets through this, so will I, about everything, but especially parenting, right? It's just what you do. Everyone does it. No big deal. We'll manage. We're as good as anybody else, blah, 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 right? So yeah, it's a row to hoe to get past that thing. But absolutely, I'm in 100% agreement with you. No more of this willful ignorance. We have to break through that and see how damaging it is to each other and the planet.
Yep. And it's a cultural phenomenon, right? Like to be in this individualistic paradigm where you do this because that's the female thing to do and that I shouldn't have to know about it. But actually, it impacts you. And there's a lot of political discussion about like, well, you know, where does blame lie? I don't think it's about blame. I think it's about opportunity to invite people into a constructive dialogue about, hey, here is how, you know, the female reproductive cycle works. And here is the part you can play to feel efficacious in supporting your birthing partner. And here is how you can break cycles of violence. And here is what we can do to be more happy, more connected with purpose.
And every single thing that you named is integrated. Right?
Yeah.
Not just a little female reproductive system over here working like a machine that does everything on its own and without reference to, oh, the social emotional stuff I'm experiencing, and oh, the grind of whatever it is, making the living, you know, it's all in there.
Yeah, we're interconnected. And when we try to over specialize or compartmentalize, I think that that's what breeds dis-ease.
Yeah.
And we're not meant to do it all alone. And I've been lucky to have a neighbor who just had a new child and to be able to hold that baby without survival being the primary focus just has been so kind of cathartic, but also brought some closure to some grief. Like, it's okay. We're all okay, you know? And I think we have to be a little bit humble, and it's okay to not know, right? I think that if I could speak to any of the men who've ever encountered me, I came with a lot of muchness and big expressions of behavior, big emotions, big responses. And that might be intimidating, but it also might be highly information rich, and you could learn a lot from it. And if you dare ask questions, then we can decode these states of madness and things that might otherwise be something we would prefer to keep out there and to other. And that's where I think we've been a little amiss, is we've been othering people. And how far is that going to get us?
Not very.
So Utah's stuck with me. I'm here in this culture, unapologetically trying to champion for holistic mental well-being, right? And to say, like, I am a whole person. I have all these parts, and they're all welcome at the table because I said so, and I'm going to dignify my own experience. They didn't know they gave me a hall pass at 18 when they said you're crazy and won't amount to much. Then it was like, oh, fine, I'll pursue my own path and show you otherwise. But I don't know. I just feel lucky that I'm still here standing, and my daughter has a marginally adaptive mom to kind of help blaze trails for her, hopefully, so she doesn't have to fight so hard to be seen, validated, supported.
Well, we're glad you're here too, and thank you for sharing your story with us and all of this wisdom.
Yeah, I think that it's important to remember that you have permission to make yourself new. And for people who are trying to heal from complex trauma, it can be so hard to integrate different parts of your shadow. But please tender yourself and ask for help, because I don't want you to make it halfway through the fearless and searching moral inventory piece and become overwhelmed with guilt or self-blame or self-recrimination. So my prayer request to you is like, love yourself through the process of change. Change is a lot easier when it's supported and guided by other people who have that willingness to employ compassionate inquiry. And if you want, like I said, to ever ask me any questions, connect with my work, I'd be more than happy to share what has helped me survive myself.
Where can people find you?
So www.iammentallyreal.com and LinkedIn or at hardynutritionals.com. I'm an unapologetic realist, right? So mental illness affects 1 in 5, maybe more of us. So let's normalize the conversation around mental health. Let's destigmatize it. And I would love to share with you how I got myself out of the woods.
Perfect. Thank you so much. And we'll put links to your website and the Hardy Nutritionals website in our show notes. And we'll also include a referral code. So you can save 15% off on these research-backed micronutrients if you use the code FOURTH, FOURTH, spelled out, not the number. So use FOURTH and you can save a little bit of money on some of the nutritional micronutrients we talked about today. And again, we encourage you to work with your doctor, your OBGYN, whoever you have in your medical team as you pursue your holistic health journey.
Thank you, Celeste.
Great to visit with you, Esther and Sarah. I really appreciate the opportunity.
You can subscribe to this podcast in order to hear more from us. Thank you for listening, everyone, and I hope you'll join us next time on the Fourth Trimester. The theme music on this podcast was created by Sean Trott. Hear more at soundcloud.com/Sean Trott. Special thanks to my true loves, my husband Ben, daughter Penelope, and baby girl Evelyn. Don't forget to share the Fourth Trimester Podcast with any new and expecting parents. I'm Sarah Trott. Goodbye for now.
Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I'll sing a song for you. You got your wheels, you got your gears. You ride around town without any fear. You got your pedals, you got your brakes. You always wear your helmet for safety's sake. Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you. Hello again, bicycle man. I know you're doing the best that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you.
Hi there. This is a quick thank you for listening and for your ongoing support. Your support means the world to us. You are the heartbeat of our program, and we couldn't do it without you. If you haven't already, please consider clicking that subscribe button and follow us to never miss an episode. There's no better way to support us than doing that, or sharing the show with a friend, colleague,
family member, or any new or expecting parent in your life. It's totally appreciated. And hey, if you've got a minute, leave us a review. Your words help other parents find the support and community they need. Thanks for listening.